Maureen, what is the difference between biostimulators and volumizers?
Okay, so yeah, patients are getting very confused as to what the difference is, and so fillers have been been going for the last 20, 30 years, and if you look at the evolution of volumizing fillers, it started off years ago with fat, when doctors used to take fat out and then inject the fat into the skin. But the problem with that is you have to actually remove the fat, and then when you inject it back, you have to make sure, you can't guarantee how much fat is actually going to stay. So they say, because that fat that you transfer has to have blood supply. So fillers are more like, consistent. What you see is what you get. So fillers, the very first fillers that I injected were like 22 years ago, and there was no training really around, and I just had to,
Yeah. I was improvise and go with it. Yeah.
Just go with the flow. And they've really evolved now, and we've come to realize that there are many dangers with fillers. So you can't just go to anybody for a filler, because the face is full of arteries, and you have to know where the danger points are, because fillers can obstruct your arteries. So it's very important to go to a doctor who knows the facial anatomy and where these danger points are. So fillers have also evolved over the years. When I first started using a filler, I started with the Restylane fillers, and then I did the Hyaluronic fillers, which didn't last very long. But they're really trying to get the grips with fillers, and they're trying to make fillers that last longer, and that fillers have to be absolutely sterile. Because once you put a filler into your face, you don't want any, side effects like biofilms and granuloma formation. So sterility, making the filler, and sterility when you're putting the filler in is, also very important. So that's why it's important to go to a medical clinic where where the place is cleaned properly, and that you're getting a sterile, a semi-sterile procedure, an aseptic procedure. So years ago, we used to chase wrinkles. Like even myself, the very first thing patient wanted was, fillers between their brows and fillers for their nasolabial folds. So doctors were chasing wrinkles. And that went on for many years. And then about 2006, I went to an anti-aging conference in Monaco, and they were talking about, because I always wanted to know how they got the cheek fillers, but no one really could tell us. And I went to this anti-aging conference, and this one doctor from Singapore, he was speaking about how he's injecting fillers around the eyes, well, not around, on the bone around the eyes, and how they're getting amazing results for, depressed, dark circles around the eyes, and depressed, deflated cheeks. And that was the first time that I started experimenting with fillers, to start putting it in other places, other than just chasing wrinkles. So now fillers have become volumizing fillers, because as we age, we lose collagen, we lose bone, we lose fat pads, our ligaments become weak, and everything sinks and sags. So there's a whole new way of doing volumizing fillers that actually, and to do it naturally, you actually have to know what you're doing, and you have to lift and separate the face. I say it's like a good support bra. That old support bra, lift and separate. Okay. So we do like a lateral lift with these volumizing fillers. So that's what, and when you do a volumizing filler, it's very important to get a filler with a high G prime. So that means a filler with a high lifting capacity. And I explained to the patients that some fillers are more expensive than others, because their lifting capacity is much higher. So the one filler, you'd have to do 2 syringes of the one filler to get what the one syringe does of the other filler. So that's what volumizing fillers do. And they just reshape your face, because your fat and your bones are the scaffolding of your face. And as you get older, everything depletes. So your skin has nothing to hang on. So that's why it's so important to have these volumizing fillers, to give you that natural look. So we've been doing that for the last few years, putting fillers in, like not just putting them in wrinkles, but actually restructuring the face. And then I used the Sculptor 20 years ago, but it was, you had to know how to use it, but we weren't using it as we use it today. So for the last 20 years, after about 5-6 years, they stopped bringing it into South Africa, so I didn't use Sculptra anymore. But the Americans and the Brazilians carried on with all their trials and that, and now they've realized that Sculptra is amazing biostimulator, so that's what's different. So it's not going to give you volume, but it's actually going to stimulate collagen. And with Sculptra, collagen is increased by like 66% over time, over the next 3, 6, 9 months. And each treatment is accumulative. So what biostimulators do is stimulate collagen, and then they also restructure the face and give you a lateral lift. And it's very subtle, you know, so it's not these pumped up cheeks that you're getting and you're looking like an alien. You're actually getting a very natural look. And it's a slow progress, so nobody really knows, but eventually people say, what have you done? Okay, and then we get the new fillers. So the biostimulators are the Profilo and the Harmonica, because that's got a very high G prime filler, which is not, it's a different kind of filler. It's not hyaluronic acid, it's calcium hydroxyapatite, and that's got a very high G prime. And then they've also, so that's 30% of the filler, then they've also put in a hyaluronic acid with it to give you the instant lift. So those two fillers give you the instant lift, and we also do it laterally, but it also stimulates collagen down the line, so your skin gets better. So that's what a biostimulator is. And then there's another bioremodeler. They don't call it biostimulating, they call it bioremodeling, and that is the Profilo. And Profilo we can do on the face and the neck.
Oh, wow.
Okay, so like, so when do you choose what? So I love the Sculptra if patients want an eyebrow lift, because there you can actually inject it into the scalp, just past the hairline. Obviously very carefully, we use a special magic needle called a cannula, we call it our magic needle, and you can actually inject this liquid, which you reconstitute with water and lidocaine, so it's actually virtually painless, and you inject it in this area here, and it's amazing how it will start just lifting the eyebrow and just, you know, giving you that fresh look. So that is what I like about Sculptra. And then Profilo is great because you can do it also anywhere in the body. You can do it on the hands, the arms, the face, and the neck. And patients are loving it for the neck because, you know, the neck is like one area that we all neglect, our neck and our hands. So that's why I love Profilo. And then the third one is the Harmonica, which is also great. You also get that instant lift. So patients love the instant lift because both those fillers have a high G prime, and then it also stimulates collagen. If you're looking for the most stimulation of collagen, you're going to get it from the Sculptra. If you're looking for the most instant lift, you're going to get it from the Harmonica. And if you're looking for, you know, just skin tightening and to be able to do it on the neck, then then I do the Profilo. So they all have their place, and they're all great. So that's the difference between biostimulators and remodelers from volumizing fillers, the old-fashioned fillers which we now use as remodeling and rescaffolding the face.
And when is a good time for us to get fillers done?
Okay, so you have to just look at your face and see what's bothering you, because most people start seeing this.
Yes.
So the whole new buzzword at the latest anti-aging conference is prejuvenation. So you don't wait until everything's too far gone. Then you've got to, throw the book at this patient, and maybe they even have to go for plastic surgery because, it's too far gone. So, like a lot of the youngsters, the young, 20, 30-year-olds come in because they want their lips done, and we like to give a natural skin, lip rejuvenation. We don't like to do those huge lips because that's the first thing most of my older patients, I must say, say, please don't give me those unnatural looking lips. They are so terrified of looking unnatural because a lot of celebrities have gone a bit too far and they just portray this alien look. So I'd say the 20-year-olds, 30-year-olds come in for their lips. Then the 30 to 40-year-olds start seeing the nasolabial folds, these lines here, because everything is now sinking and sagging, and it's falling over the excess skin. The skin that's now sagging is falling over this ligament here. So they come in for their nasolabials, and then we explain to them what's happening to the face, how they're losing bone, how they're losing fat, and how we need to lift the face. So sometimes I give them a little bit of the lateral lift, and then with volumizing fillers, and then I also give them a bit of nasolabials. And then the youngsters also come in with the dark eye circles, not quite sure what's happening. Maybe they're not sleeping well, so So that's very important. So we start doing fillers around the eye just to reduce that volume loss and those shadows that are created when you have volume loss there. And I even get young 32-year-old males coming in and telling me they've got these dark circles, no matter what they do. And then very often they've got a sleep problem, they've got a sleep disorder, and then I explain to them, I always ask, I know I'm always on it, how you sleep. And then, one or two people have actually been diagnosed with sleep apnea, 32-year-olds with these dark circles. So that's how important sleep is. And then the older women come because they see the gels. They can't stand these gels. I had a patient the other day where I just did one filler with a high G prime lift, and we're actually doing a video of her, and actually went to the mirror. She said, I can't believe that just one filler can just make such a difference. I don't have to wear these big earrings now to hide my gels. It was so funny. So it really can make a difference. Even one filler with a high G prime lift can make a difference. And then we gauge, on how many fillers we need according to your decade. So if you're 20, if you do your lips, 30, you might do your lips, your nasolabial folds, and your dark circles. If you're 40, you might need 4 fillers, 50, 5, 6 fillers. So that's how we gauge fillers. And, we can't expect miracles, with one filler to fix everything. I tell them I'm a physician, not a magician. But they understand, and we explain to them that it's not a sprint, it's a marathon. It's a journey that you walk with us. So we start fixing everything little by little, and slowly we'll get to the end point, and then obviously maintenance. It's so important.